Hi, everyone. We're back and ready to start the next session Global Health, the Peril and Promise of Living in a Shared World. Global health is top of mind for most health and public health professionals. But for most of the public, the implications of global health aren't as clear. When a disease from another country arrives on our shores, SARS, swine flu, MERS, Ebola, attention is focused on it until it is no longer a threat to us. Those diseases, with the exceptions of Ebola, didn't frighten most of us enough to want to understand the origins or track the diseases. Without a long term, dire threat to health and safety of our nation at stake, most people weren't that interested. COVID 19 has changed that and focused the public's attention on One Health concepts, animal to human transmission in China, arriving in the US within a month or two, starting with the travel related cases and deaths, and then community spread. While the pandemic has rocked our world, there are many other threats from living in a shared world, but also promising shared solutions. Our moderator for this panel is Eric Bakota, Harris County Public Health Science and Research Manager. But first, kicking off this topic is panelist Dr. Ethan Jackson, the Senior Director and Principal Researcher at Microsoft Healthcare. His research focuses on intelligent systems that make people and the environments around them healthier. Dr. Jackson's background is in cyber physical systems, program verification, and programming languages, which he applies to develop novel health-related technologies. He directs Microsoft Premonition, an advanced incubation project aiming to detect the movements of potential pathogens in the environment before they cause outbreaks in humans. Our health department's Mosquito Vector Control Division is honored and grateful to work with Dr. Jackson, helping with the pilot program for Microsoft Premonition. Thank you for joining us today, Dr. Jackson.
Oh, okay, I'm unmuted. Thank you. Thank you for that kind introduction. Wonderful. So I guess I'll just jump right in. So my name is Ethan Jackson, and I'm Senior Director at Microsoft Health. I guess the point is that if we think about how we predict phenomena today, weather patterns, traffic patterns, power consumption, we do it with sensor networks. Those are literally hundreds of millions of sensors scattered across the globe that provide us with real-time data about certain phenomena. And this has really been a revolution in data science and AI that gives us those data streams that allow us to predict these very complex phenomena. But what's really amazing, if you think about it, is that most of the life forms on the planet, viruses, bacteria, terrestrial invertebrates, are invisible to these hundreds of millions of sensors that we have across the globe. And so that means we can't spot environmental pathogens early enough to predict or to stop outbreaks before they turn into large epidemics. We can't do things like detect invasive species before they're widespread. And even we can't easily monitor, in many cases, the efficacy of public health interventions because we don't have that fine-grained real-time data that lets us understand a feedback loop, how what we do impacts what we're trying to control. And so what my team really thinks about is how do we build the future sensor networks for monitoring and detecting biological threats early? In a nutshell, that's what we do. I'll talk a little bit about Microsoft Premonition, which is our attempt to do this. It certainly isn't the only approach. So through the lens that we take on it, we have really decided to start from the perspective of the arthropod. In fact, the most experience we have is working with mosquitoes. We started this project about 5 years ago. We were lucky enough to test some of our first systems in Harris County during the risk of Zika emergence. And the way we think about it is arthropods are things that we know are going to be in the environment all the time. They have, they're of course the most diverse terrestrial animals on the planet are, they represent most animal biodiversity. And we can literally build weather stations that lure them and monitor them, autonomously identify them, and then give us this kind of real-time data, providing this weather map at the very least of what this large segment of life is doing. And of course, from the public health perspective, and actually from the One Health perspective, we know that they're incredibly important because they're primary disease vectors of things like chikungunya, dengue, Zika, malaria. Of course, on the agricultural side, arthropods are both beneficial, but they're also agricultural pests. In the livestock side, they're also vectors for important pathogens. So for us, it's a really interesting place to start to think about how would you build a sensor network which brings a new lens into the distribution and evolution of life in the environment. And so those are the things that that our host just mentioned that we are excited to kind of continue down the journey, setting up in Harris County at a scale where we will start to see what will happen when you get 24/7 continuous real-time data about things like Aedes aegypti, Aedes albopictus, Culex fasciitis. How does that change the way that we think about potential pathogens and we control our environment in these closed loops? The other thing that we work on is a technique to take environmental samples and try to understand what's in them. The way we do this is by taking an environmental sample and extracting its nucleic acid, its DNA or RNA, putting that through a DNA sequencer, and then digitizing all of those molecules, all of those DNA and RNA molecules. And then we take that digital data and we computationally scan it against a database of all partially sequenced life. And today that database that we use is about 3 trillion nucleotides. So you can think about it like computationally running in one shot 3 trillion tests on a sample that you got from the environment. And what that allows us to do is take a lens even deeper into smaller things that we can't see. So arthropods, we can at least see them with digital sensors. But viruses and bacteria, we need to go even deeper. We need to go into their genomics. And so this technology allows us to take an environmental sample and identify the life forms, some of which may be known, some of which may be novel, from a sample that we've collected from the environment. So bringing this back to, the overall sensor network, the way that you can think about these two technologies working together is IoT style, that is kind of this digitization of arthropods, allowing us to have a good understanding of what the environment looks like through its arthropod populations, but then the ability of these weather stations to sample the environment for things that are interesting. An interesting thing may be a mosquito that survived a treatment of insecticide, or it may be an arthropod whose biometrics looks very different than anything that we've seen before, maybe signifying a potential invasive species. So these are the things that we would prioritize to bring back from the environment, sequence them, and then ask, what is all of the life forms that are associated with that sample? And that can be everything from, what animals is a mosquito feeding on, all the way down to, to what known and novel viruses are associated with it. So those are the two technologies that our team works on. And what one is getting at things that are small but macroscopic, and the other are getting at things that are microscopic, where we really need technologies like DNA sequencing to see them. Maybe one thing I'll just add into this ramble is in the example of COVID, one of the things that we're learning there is that environmental sampling is actually a pretty reasonable way to detect the prevalence of COVID in the environment. So just to kind of contrast that about a sensor network that makes it very easy to take environmental samples, sequence them, and then scan them for many types of threats. That's what this kind of genomic technology could potentially be, useful for earlier in an outbreak, when we didn't kind of know everything that we know now, and we didn't have the targeted test for COVID that we have now. So I guess, to kind of round out my rambling here, the thing that I just want to, from the One Health point of view, convey to, that is really exciting to me watching Microsoft Premonition unfold is thinking about what these future sensor networks look like for detecting biological threats is just an incredibly cross-disciplinary problem. My team is probably one of the most cross-disciplinary in Microsoft. My background is in, I think as was mentioned earlier, robotics and cyber physical systems. but my team also contains mechanical engineers, electrical engineers, AI folks, entomologists, geneticists, and even then, that's not enough to actually really figure out if we're headed in the right direction. And so beyond that team, we have always collaborated with academia, both on the engineering and biology side. We have collaborated with public health, as was mentioned earlier. And so if I look at the challenge of really trying to, detect threats before they generate epidemics and pandemics, I guess one of the major takeaways I'd like to just leave with you all is that it's an immensely cross-disciplinary problem. And I think at the point we are in science and technology, it's a really great time to start to fuse these disciplines together and really start to figure out what are the technologies, the policy, the biology that we need to build to tackle these incredibly hard problems. Okay, so I think I'll stop there unless our host wants me to ramble anymore.
Thank you for that, Dr. Jackson. I'm trying to turn the video here, and Kim, I think you're going to have to let me turn it on. Having a little bit of technical difficulty. It says the host has to allow me to turn it on. So that would be a Kim. The host is in. Start my video. Perfect. There we go. Hi, everybody. Sorry about that. What's an online virtual conference without a little technical difficulty? So thank you, Dr. Jackson. I'd like to also introduce our two other global health panelists. First is Dr. David Fleming. He's PATH's Senior Vice President of Public Health and Chief Medical and Public Health Officer. PATH is an international nonprofit global health organization working to accelerate health equity so all people and communities can thrive. Dr. Fleming provides strategic leadership and guidance to the organization in achieving its mission of addressing health equity in PATH's activities around the globe. As PATH's former vice president of the Global Health Programs Division, he oversaw PATH's presence in country offices and responsible for PATH's scientific expertise in sexual and reproductive health, child health and nutrition, non-communicable diseases, malaria, HIV/AIDS, and tuberculosis, as well as health systems innovation and delivery and digital health. We're glad you could join us today, Dr. Fleming. Our third panelist is Dr. Saira Madad, who is Senior Director of System-Wide Pathogens at New York City Health and Hospitals, the nation's largest municipal healthcare delivery system. She's a member of the COVID-19 Expert Task Force at the Federation of American Scientists. Dr. Madad was featured in this year's Fortune 40 Under 40 list of most influential in healthcare and Elemental's 50 experts to trust in a pandemic. She also plays one of the lead role in the Netflix docuseries Pandemic: How to Prevent an Outbreak, which follows a handful of leaders throughout the world on the front lines to prevent the next outbreak. Welcome, Dr. Madad, and thank you for joining us. So thank you all for joining us here at our One Health conference. And obviously we're in the midst of COVID-19, a global pandemic, and we're talking about global health. So I wanted to start there. And I wanted to hear from each of you your thoughts on what did we learn about the One Health approach, the global health and One Health approach from COVID-19, and what did the global health and One Health approach teach us in terms of how to better respond for the next pandemic? Dr. Fleming, let's start with you.
Thanks very much, Eric. And it's a real pleasure to be here this afternoon. I appreciate the opportunity to be on this panel. That's a great question. And just a couple of points. First off, I think there is probably nothing like a global pandemic to make us all realize that the world is interconnected. And in order to do our jobs locally or the places that we work, we need to be paying attention to what's happening in other places and learning from other places as well. And as we approach COVID and begin to think about solutions, the nature of the pandemic also is that the solutions that we come up with need to be broadly scalable as well. We can't get rid of this disease by just worrying about its presence in our local jurisdiction. For me, a second learning, though, is that Perhaps in the United States, we've suffered a little bit from thinking that we always know the right thing to do and think of global health as spreading our expertise to other parts of the world. I think COVID has shown us clearly that we don't know how to do everything. And in fact, we can learn from successes that are occurring in countries different from ours. It doesn't take us too much trouble to look beyond our own borders to countries in Southeast Asia, for example, and the innovations that they've employed using digital and data techniques, but also non-pharmaceutical interventions to hold this epidemic, at bay in their countries while we have not. So there is a lot to be learned as we move forward, and a lot to be learned about this epidemic that's coming. I think all of us right now are very worried that as we see almost universally globally an uptick in cases that are occurring as cold weather descends on us, that we may be seeing the beginnings of that dreaded second or third wave, and need to learn from that. And then finally, I think that this epidemic, this pandemic, not surprisingly, has shown us once again that those of us who are the least fortunate, the most marginalized, are the ones that are the most likely to bear a disproportionate burden of disease. That's true in everyday life, in everyday disease, and it's certainly true in this pandemic. So as we're thinking about how to approach this, we need to remember some of the lessons for handling health inequities, including being sure to engage with those that are most effective to learn their perspective and their ideas for solutions that are going to work best for them. To think about the metrics that we create that make sure that we're capturing the extent of the disparity and we know where the disease is striking most severely. And to measure our approaches and the things that we're doing to intervene to make sure that they're not only working in populations of power and privilege, but also in populations that don't have those benefits. So a lot to be learned, I think, and I look forward to the rest of the conversation we're going to be having. Thanks, Eric.
Dr. Madad, you want to go next?
Yeah, absolutely. So first, thank you for the opportunity. And I think just, adding a little bit more to what Dr. Fleming has already mentioned, if we just, I think what what COVID-19 has demonstrated is really the global failures that, in terms of not taking pandemic preparedness and response seriously. And we're seeing that play out today throughout the world. A number of countries have been doing much better than others. And I think that's also very visible in terms of the progress that's being made. But I think another thing to also think about is that if we just take the phrase, an ounce of prevention is worth, a pound of cure. And if we relate that to COVID-19, we're dealing with, at least a $16 trillion virus and counting, right? So that's just the scratching the surface in terms of the economic damage here in the United States. And had we invested just less than $5, per person every year, we would have been in a much better state. And so, preparedness, we know, saves lives, both from a public health and a healthcare delivery standpoint. And so what COVID-19 has shown us across the world, and as what we can see and learn, is that, it is adding fuel to the fire. It's showing inherent inequalities that we've seen in public health and healthcare delivery systems around the world, and how we need to do better to ensure that we are caring for those that are, the most marginalized, the most vulnerable. And we know that you can't have health security until you have socio and economic security. So they all go hand in hand. And I think that's, again, very, very clear. I think there's a lot of lessons learned that we have seen currently being played out with the COVID-19 response from that One Health lens, if you will. And I think one of the things that I'll just highlight, and I know we'll talk more about this, in this current panel, is the risk communication that is happening, in a number of different countries. And then if you play that out and compare that to here in the United States and other countries, you're seeing that, One Health is not just about the drivers and influence of various environmental factors and animals, but it very much also deals with looking at additional factors and mechanisms that bring us all together in this interconnected world. We know that politics and global leadership matter a lot. Risk communication and your communication strategies also matter a lot of how you're communicating that to the public. So I think that's one of the biggest lessons learned that we're learning in real time right now.
Dr. Jackson, you want to round us out?
Sure. Yeah. So from from kind of the perspective I mentioned, I think echoing the comment about an ounce of prevention is worth a pound of cure. In the research that we have been doing, we obviously don't yet have a global sensor network that would have spotted a zoonotic outbreak yet. But I think this is a really good example of what I said earlier, where science and technology is at a place where we can really bring these disciplines together and rethink how we do pandemic preparedness. So we missed this one. And in fact, in the history that of which is a short history that Microsoft has been thinking about this problem a good 5 years. We've seen epidemics and outbreaks probably every 6 months. In some cases, they are known pathogens that we just didn't expect to see. Zika, for example, when we were working with you all at the beginning of this in Harris. In other cases, they are, they're completely new to science. And so we know that these things are going to happen again. We know that the periodicity of them is frequent at a level that's pretty scary. So I think it's from the maybe representing the technology side of the equation. It's time to get better technology and systems, and to think about that from a holistic point of view, from really a kind of a One Health point of view. That ounce of prevention worth a pound of cure. Let's all work together and get it right.
Yeah, it's interesting. Dr. Fleming, you kind of all touched on a similar theme. Dr. Fleming mentioned that the world is interconnected. Dr. Jackson, you talked about a network of sensors, and Dr. Medad, you talked about needing political and subject matter expertise leadership when it comes to risk communication. And those three issues seem to come together on the global sphere through the WHO. And so my question to you guys is, does an organization like the WHO or other global leaders in driving public health and global health and One Health, what do they need to be able to help us for the next one when it comes down the road? What improvements are needed for these global systems?
Well, to get political for a moment, WHO needs financing, including financing from the United States and including support from the United States. It's a truly global treasure, but can only function with countries participating in it. So that's number one. Second, WHO is a great organization, and its reach is limited. It can do some global normative setting, but in addition, it needs assistance, and it needs the technical expertise to build the capacities that we're talking about in all countries. I think we've learned from epidemics, pandemics to date, Ebola would be an example, that a disease is going to occur in those places that are least able to detect it and cope with it first. And therefore, for any of us to be protected, all of us need to be protected. WHO is part of the critical global infrastructure working to make that happen, along with UNICEF, the World Bank, the multilaterals. But this is a job that we all need to take seriously, both with respect to donor aid, for example, from USAID to countries to build capability, as well as assuring that we're building the capability in countries in a sustainable way by training and engaging country nationals in the work. So this global effort at its heart is really a diffuse global effort where we all need to be a part of it.
Dr. Medad or Dr. Jackson, do either of you kind of want to respond or build off that?
Yeah, so I think just I'll add a couple of more comments to that. In all the various epidemics and pandemics that collectively we've all responded to, the 3 C's always come to mind, that we always need to do from an international standpoint. That's communication, that's coordination, and that's collaboration. And when we do all 3 C's, we have a successful outcome. We're able to save more lives. We're able to prevent further illness or reduce the number of illnesses that are happening. And when we don't do that, both at the local, state, national, and an international level, then essentially we're failing. And we're seeing, again, that play out as well. The other concept that I'll just, briefly mention is from a healthcare delivery side, the timeline that we tend to have for hospitals is very, very quick. And what I mean by that is, when an infectious disease outbreak starts, we know a health threat, anywhere is a health threat everywhere. And so when it starts and it comes to other countries, our timeline is very, very rapid. We don't have the luxury of 2 weeks or 3 weeks or 4 weeks for, to have a clinical case definition come out to tell us, okay, this is what we're looking for. And so we need to have this brain bank concept where we have expertise from a multidisciplinary approach come together that is able to provide in real time the knowledge that's needed from both a public health and healthcare delivery standpoint. So that way we're able to see what are we dealing with, how can we tackle this problem, together, and then build upon the response. A lot of this obviously does take time. We know we want to be first and reliable, but at the same time, we want to make sure that we are collaborating at the international scale, utilizing the intelligence of so many scientists and researchers around the world in this kind of brain bank concept. So it's really important that we invest in these international organizations that can help facilitate the preparedness and the response and the mitigation and the containment, all those phases that we are really in right now.
And I guess the thing I would add is, again, kind of looking from the technology lens, the more that the energy spent to protect us from pandemics generates value for systems that operate all the time and in many different contexts. The more that we can have our eye on the environment. So again, kind of going back to a very One Health point of view. Here's a concrete example of that. One of the things that I think is incredibly interesting about vector control and vector surveillance is, yes, mosquito-borne diseases generate 600 million cases of disease per year. And they have major impacts on economies and populations, 2 million deaths, over 2 million deaths per year. But at the same time, if you think about those systems, they're one of those systems that will predictably be out sampling the environment in many, many different places. And I think if you look in different industries, you will see systems like that. They're out there for a reason, a specific reason, but they're interacting with the environment. They're collecting data from a point of view where, if you bring those data sets together, you get maybe a sum which is bigger than its parts. And so from the technology point of view, I think well, from a policy point of view, the organizations like the WHO are incredibly important to coordinate all of that. But I guess the challenge I would pose is, how do we take the activities, country level activities that are interacting with the environment, they're out there early, they're out there for a specific mission, but then generalize the data that they're collecting so that we're getting an overall new lens, an overall new sensor network on what's happening in the environment. I think there's a huge opportunity there, and it may even kind of require a little bit redefining the missions in some way of what these various organizations do.
Thank you for that. I appreciate you guys' thoughtful answers. And I want to take a minute just to remind everybody to be sure to put your questions into the Q&A box. And we will take them now, and then we'll open up to the panelists for questions here in a few minutes. In the meantime, my next question is for you, Dr. Jackson. What are some promising solutions to predicting and detecting viral pathogens? You've mentioned different sensor networks and ideas. Could you unpack one and dive into it a little bit deeper for us?
Sure. So the one that we have, okay, I'm going to be biased here. I'll talk about the one that we've been exploring, and that's metagenomics. Metagenomics is built on the back of the advances in DNA sequencing. I think from the pandemic preparedness point of view, one of the really exciting things for us is that DNA sequencers are becoming more and more portable and more operationalizable in the field. And so when one of the things that often pops into our head, depending on how much DNA sequencing you've done, is that it means that you need to be near this gigantic lab. It takes a building, and if you're not near that, you don't have access to its capabilities. But today, there are sequencers that are the size of an eraser. They have higher error rates. They have some challenges with them. But you can put them in a suitcase and you can take them out to a remote environment, and you can go from an unknown sample to digitizing its DNA and RNA. And then from there, you can take that to the cloud, where you can do something that we really couldn't do before, which was scan that against everything that science knows about life today. So that's an example in my mind of a capability that we're just kind of reaching the tipping point of being able to operationalize that. For the sake of clarity, Microsoft, we don't build these sequencers. So again, it's really built on the great science and engineering that a number of companies have been doing over the last several decades. But I think from the point of view of how would you detect, a totally novel thing where you just don't, right? You don't have a name for it. You don't have a PCR test for it. These are the kind of things that we'll need. The question is, how do you get them out into the environment? How do you make that an economically sustainable activity to do? Because they are more expensive, of course, than an ELISA test or a LAMP test. But I think it's a good challenge to have. And it's kind of why I will keep harping on how do we rethink the interconnection between policy ecosystems, logistical ecosystems, because, hopefully there's something there that allows the space for the deployability of these systems into the environment where we have them near where the next phenomenon is going to pop out.
So Dr. Galea in the previous panel said, there's no silver lining in a pandemic like this, but it sounds like perhaps some of the response to today's pandemic is going to help with these advances in genomics will help us for tomorrow's.
Well, yeah, I guess I would phrase it this way. If you look at it from the point of view that you needed to have, a sequencer collect the sample, you need to have a person collect the sample and sequence it. And that was a sample that just generated, the first instance of SARS-CoV-2 in humans. That's an impossible event, right? You will not have a sensor, whatever technology you pick, at that exact moment. But what we know, for instance, from coronaviruses is that maybe there was an evolutionary signpost, right? That was pointing towards evolution driving in that direction. And actually those signposts were there, right? We had SARS, we had MERS. There are a number of groups, some of them funded by USAID Predict, to go out in many countries and actually sample bat coronaviruses. And what do you see? You see an evolutionary signpost pointing in a direction. And so if we can get a better read on that, I think the hope is that it points you to what's going to happen, and it kind of takes out of the equation that you had to be right at that exact moment where something, where spillover occurred, because that will always look like an impossible event to detect. Now, to get there, we need, the way I look at it is like the weather, right? We needed that kind of weather style data about the distribution, evolution of life to kind of catch that storm was coming. But the hope is that if you could see that weather map, it would actually give you, a signal that you should be headed in that direction, you should be looking in that direction, as opposed to you need to detect that rare event at the exact moment that it happens. So I think that's kind of the mental shift, the hope anyway. It still needs to be, shown to work. but we're getting, I think we're getting there.
Very cool. Dr. Fleming, this next question's for you. And you mentioned earlier that global health isn't just about us projecting to the global sphere, but learning from them as well. And so I'm curious, what have you and Path, what have we learned from the global community, and what can we here locally take from that to apply as we respond not only to COVID-19, but just public health or One Health in general, to be better public health practitioners?
No, it's a great question. And I think that the short answer is a lot. And particularly as it relates to more community-based ways of responding to this problem. I think historically in the US, we've made huge investments, some might argue over-investments, in our healthcare delivery infrastructure. So we become very good at treating sick people, not necessarily as good at keeping people healthy in the first place. In many other parts of the world, that paradigm has been just the opposite. And so in most places, there's been a lot more resource and a lot more work on interventions in communities to keep people healthy. And in particular, interventions in communities that are poorly resourced, such that you can frugally innovate and do things that are good for communities. That's a lesson that has been learned, and those strategies that are out there that have been shown to be effective are strategies that we should import. The classic one, of course, that people always point to is the concept of just a community health worker, and how having people of and from a community working within a community to learn about the ways that people are thinking, to educate people and to help mobilize people is something that's commonplace, has been commonplace for years in many other parts of the world. We're just beginning to take that on here. One other example, in the rest of the world, when they talk about primary health care, they don't talk about it in the same context that we do, which is what is the physician or healthcare provider going to do when you walk into the clinic to triage your care. Primary health care in the rest of the world is what can people be doing in communities to keep healthy. And there's this whole concept of self-care, which is what is it that we can empower and enable people to do in the places that they live, work, and play to stay healthy. With the advent of the digital and data revolution, the ability now that's being demonstrated in other countries to put health within the reach of even very poor people through inexpensive digital and data technology, again, is something that we need to be looking at and we need to be importing into this country. I could go on, you can tell I'm enthusiastic about this, but there really is an opportunity here to take the best of what's been learned around the world and begin to use that here in our country to really start talking about creating health rather than treating disease.
Thank you for that. And next, Dr. Madad, question for you. Through your experience working on the front lines of the pandemic at New York City, what challenges have you faced in the healthcare delivery system and the public health system, and what have been the impacts of a global health crisis at the local level? And what are some possible solutions to improving those systems?
So I think one very glaring global health issue that we're all experiencing, and even now in kind of this third peak that we're slowly trickling in and currently are in, is this whole supply chain constraints. So I think just to give a little bit more information on the significance of supply chain and how much it has impacted the way that not only are we delivering care, but how we're obviously preparing for this current pandemic and the subsequent peaks and valleys that we're in. So I think just starting off, there's been so much progress that has been made from both the public health and healthcare delivery standpoint in terms of processes and infrastructure over the many years. We have better vaccines, we have better tools in our toolbox for a number of different diseases, better sanitation. I mean, you name it, there's been a lot of innovation over the many, many years in both of these very distinct fields, if you will. But one field that has not really had much progress or innovation in is the global supply chain. It's really been stuck in the past. And I think this pandemic has revealed the dangerous dependency that the world has on this particular supply chain aspect. And to even give us some data and just how significant this particular aspect has been in our pandemic response now and also in the future, you know, here in New York City, the very first lab confirmed case we had was March 1st. A number of healthcare systems started to place orders for various types of supplies and equipment like PPE in January. And at that time, manufacturers and distributors already put many healthcare systems on allocation. And what they had mentioned is that we would not be able to fill your orders based on, so basically they would just only give us enough based on the past three months order. So if you ordered, you know, X amount, that's how much you're gonna get for the subsequent months. And in April, for example, you know, within our healthcare system, we were burning through 300% more face masks and 600% more isolation gowns than we were doing in January. So our baseline completely obviously increased quite a bit, yet supply chain was not able to meet the demand of the need, both in a public health and healthcare delivery standpoint. And that really put a huge damper on things. And I think a lot of healthcare systems had to very quickly pivot from conventional capacity to contingency, and then very quickly to crisis capacity. And unfortunately, we're seeing that again. And this is not something new, and if you just take a quick trip down memory lane, something that I remember very vividly is in 2017 when Hurricane Maria hit, we had significant national shortages of saline because of Puerto Rico. And we were also faced with a very severe flu season during that time that exacerbated that threat. So we have known about this dangerous dependency for many years, and we've had many events that have shown that this is something that would bring all of us to our knees, and it's playing out again. And so I really do think that, from this particular experience, that we learn from it and we look at how we can better the overall supply chain, because this impacts, obviously, as I mentioned, not only the delivery of care, but protecting the workforce and making sure that we have an adequate response. And so that is one very big, lesson learned. And we are, from a global and local standpoint, there are some solutions that are happening. So here in New York City, we have what we call almost these wartime factories. You have, factories that are popping up that have been repurposed, and they're making their own face shield, they're making their own isolation gown, because we can't, depend on the global supply chain. And so those are some innovative solutions that are coming out, both at the local level and what we're also seeing at the global level.
So I wanted to ask each of you a question individually, but this is the One Health conference. This is all about how things interact and intersect. And so now I want to open it to you guys to discuss. We have somebody from a global tech firm. We have a nonprofit with a global view, and then we have a local perspective that has obviously a global international community at home. And so what can you guys learn from these other sectors that are here in this panel? I'm really interested in knowing how can they better collaborate? How can these different sectors better collaborate within your community and within your organization?
Let me start quickly to say that it's critically important that we learn how to collaborate better. I think what we're learning once again from this pandemic is that no single approach can actually solve the problems that we're confronting. It's a little bit trite to say, but it's actually a multi-sectoral, multidisciplinary strategy that's going to be the winning strategy overall. And that's true even for elements of this. Let me just give one example. The whole all the work that has been done on case identification and tracing of case contacts. Clearly, there is an element of that is highly and should be highly dependent on technology. The ways that we've done that in the past are inefficient, ineffective, and the kinds of things that Ethan and others are working on are going to make it far easier for us to both identify and track the information that we need to do the work. But Sarah, who's been working on this, will also know, and this is also what we're finding here in Washington, where I live, that identifying cases rapidly is only part of the issue. And in many places, the whole process of notifying contacts is falling apart because of cases of distrust and unwillingness to trust the system to relay that information, not necessarily something that has a data or digital approach, but more of a human and communications approach, as she was discussing. And then finally, from an equity perspective, while it may be not so difficult for someone who has a job that pays for sick leave and lives in a house with plenty of space to do what needs to be done, that's not true for our most vulnerable. And so in addition, we need to be thinking about, from a political and social services standpoint, how to make the resources available to enable people who need to isolate themselves and take time off from work to do that in a way that's survivable for them and their families. So that's just one little problem that we're confronting, that the solution has to be a cross-sectoral solution for us to actually get to the end.
Dr. Madad, do you want to pick up where Dr. Fleming left off, how you see improved collaboration among different sectors could help our response efforts?
Absolutely. I think that one thing that I'll mention is the technology aspect and making sure that we are providing more technology and innovation at the front lines. We hear a lot about really amazing, different types of platforms that various different federal agencies have been putting together for many years, these microchips, these surveillance systems, but at the front lines, we have not been seeing it. And I think there's a couple of tools I think that would be very, very valuable. So first, if you look at just different infectious disease outbreaks happening around the world, there's hundreds of them at any given moment. And so for healthcare workers to know what is happening around the world, and if a patient's coming from X country that's reporting an infectious disease outbreak, putting that 2 and 2 together, as easy it may seem, is not very easy because you don't have a lot of these decision support tools where you need them at the front lines where patients are presenting. And to give you an example, just last year, based on 2019 data, provisional data that the World Health Organization has released, there were over 500,000 confirmed measles cases in over 180 different countries that were reported. And as we know, measles is one of the most highly infectious diseases known to mankind. New York City, we were just battling a pretty terrible measles epidemic just a couple of years ago. And so that really shows you that we're obviously very much highly connected, and these outbreaks are happening all around us. But you can't rely on that astute physician to know that this is a patient coming in with measles versus COVID-19 versus X, Y, and Z. So really important to build these tools and analytics and resources at the bedside. And something as simple as these travel screenings that can be embedded in electronic health record systems. Every healthcare system uses an electronic healthcare record system, whether it's Epic or Quadramed or Cerner. I mean, there's so many different out there. The one thing that is so basic that we're all lacking is some of these decision support tools that's embedded in the this type of platform, where if the patient comes in and they're saying they're coming with a hallmark sign and symptom of fever and rash, and they just traveled from Ukraine, that healthcare worker is not going to know what's happening in Ukraine unless you have some sort of a pop-up or a best practice advisory that says, hey, this person has traveled from the Ukraine, there's an active measles outbreak there. It'll prompt them to isolate this patient faster, and what this will enable us to do is, it's all going back to basic infection control. The faster you can implement source control and some of these basic infection control measures, the lesser number of cases you're going to have. So it's just these very simple solutions that I think will go a long way. But we just need more technology at the bedside, at the front lines. And there's so many more examples that I can provide. I mean, I think that's one that's top of mind. I think the other thing that I'll just quickly mention is, we're heavily relying on epidemic intelligence both at the public health and at the healthcare delivery level, and making a lot of our decisions, what's happening today and how we can prepare better for the future. And so technology plays a huge role in how we're responding to COVID-19. So we need to, invest more in, science, technology, and math, and all of these, STEM fields to make sure that we are continuing to provide, the various types of resources that we need and the innovative platforms that we would want in the future, because we can't have band-aid approaches and things that are fixing today's problems. We need long-term solutions because, I think as all of us have mentioned, these events are inevitable. You're going to see another type of pandemic, whether it's today or tomorrow, it's going to happen. So we absolutely need to look very much through a future lens in that One Health approach, and how we can not only look at protecting Americans, but everybody around the world from the lessons we're learning today to build a better future tomorrow.
It's from my perspective, one of the most exciting and I think fulfilling parts of my work is the opportunity to collaborate in an incredibly deep way with many different fields. And when I say that, what I really mean is, much of my day-to-day existence is like having my mind blown by, people who work on totally different things, and then trying to digest it, sort of juxtapose it, fuse it. And I think that when that can happen, when there's a space for that, really magic can happen. And so I think the key question actually is, how do we create spaces for that kind of magic to happen? I can talk a little bit about how we're able to do it, but then also recognize that it's not the status quo, right? So in the case of Microsoft, Bill Gates had a strong belief that it was important for Microsoft to always do research independently of the current products that it has. Because if the only reason we innovated was because of what we were doing today, we would miss out on the future, right? So that was a point of view that he had. And that led to a research organization with over 1,000 PhD researchers worldwide, able to explore spaces for going on 25 years now. And that serves as an anchor point, a very unusual anchor point in the tech sector, to be able to take a problem like pandemic preparedness and say, let's, if we're looking, first we can look at it. We can look at it through all the technological lenses we have. We can reach out to 1,000 PhD researchers if we don't understand one of them. And if that is not enough, we can create the anchor point to go further. And that's what we have done with you all at Harris County, and why we brought you in at the very beginning. If we didn't, we would probably make something up that would be totally useless. And why we brought in academic collaborators very early in the biological sciences, in core virology. It's that fusion that I think is necessary so that the technology is there, but it's also the right technology. Now the question is, how does that generalize? Because we are a very specific instantiation of of tech. One thing I'll just highlight that I'm seeing on the academic research side, especially for those on the call from academic institutions, is the NSF the NSF's new program called the Convergence Accelerator, which we're participating in with Harris County, Johns Hopkins, University of Pittsburgh, and Vanderbilt. And that Convergence Accelerator is really trying to say exactly this. A requirement is bring together academia from multiple disciplines, industry, startups, government, bring them all together and define something. And the metric of success of that is actually that combination did something that each individual unit could not do. So that's sort of looking outside of my own ecosystem, the things that I'm seeing that I'm really excited about, because it is a structural question. How do you incentivize this kind of cross-disciplinary fusion when many of the existing funding, startup, industrial silos actually are kind of against it, right? But I think maybe as we're seeing, how important technology is, in a cross-cutting way to health and life sciences, how lessons, let's say on CRISPR, translate into places you never thought they would. It's more and more obvious that we need to create these new kind of structures to accomplish this fusion. So sorry, that was a very rambling answer, Eric, but it's something that I think is super important. I don't think we have the recipe yet for how to do this, but I guess for everybody on the call, I would just really, it's a little bit crazy sometimes jumping into a deep end where it's outside of your classic area of expertise, but it's what we got to do. And for those leading policy, we have to think about how do we incentivize that fusion in a way that may be very different from how our incentive mechanisms are done today. Okay, sorry, that was way too long of an answer, but obviously it's something that keeps me awake at night.
I appreciate it, and while you were talking, I was as a science research unit manager here thinking, how do I convince Dr. Shah, my boss, to hire 1,000 PhDs so that we can do all the science and research we need to do here? So I may tap you on how to do that.
I'll try to give the best answer again.
For the next question, I want to bring it back to something we brought up at the beginning, which was around risk communication. And what can we do, what can we learn from the global sphere on how to communicate public health and One Health and global health more effectively? Dr. Shah, again, he always talks about the invisibility crisis of public health and local public health, and that was especially true before the pandemic. Obviously, right now, public health is in the spotlight, and we have this opportunity to convey a message around public health and global health. What should that message be, and how do we communicate it to our partners and to our public?
So I can go first and tackle that. So public health has never been more important, as we've seen obviously with COVID-19. And I think the very first thing is making sure that we are putting the value in public health that's obviously needed. We know how valuable it is. It's not just responding to epidemics and pandemics and outbreaks when they occur. We always see public health as, it's the silent work that's being done that is enabling all of us to live our healthiest life possible. So you don't see it, you don't know it. You don't even know how many epidemics and pandemics and outbreaks, public health is preventing. That doesn't even come to the level of making the news. And so first, making sure that we are putting value where value is deserved, making sure that we are investing in public health, making sure we have the resources that we need. We know that there's always been this boom and bust, panic and neglect cycle when it comes to public health. There's a problem, we inject millions of dollars into it, and then when that problem starts to dissipate, that funding starts to dissolve. So that infrastructure that has been made from a public health standpoint is no longer, is no longer able to sustain itself because of the lack of funding. So I think it's very much making sure that we sustain our gains. We're making sure that we're putting value to public health. We're making sure that our experts in public health are coming to the forefront. They are the ones that have the knowledge as well. We hear a lot in the media from a number of different amazing, spokespeople that are telling us what's happening from a medical perspective. We're not hearing enough from our public health community. And we know that in the United States, we have a very much, a bottom-up approach versus a top-down approach. And so we want to make sure that, this epidemic is playing out in 50 different ways across the United States. And so we're hearing from our public health colleagues of, what is happening and what they need. And it's always, when we talk about risk communication, there's the good, the bad, and the ugly. And transparency is key, making sure that we're telling them how it is and what we need to do. So I think those are just a couple of things that come to mind.
That was really well said. And just to quickly add, from just a tactical standpoint, 3 things. One is building on the transparency comment. We are on a risk communication strategy right now. And when you're speaking about risks, in addition to transparency, it's always clear, it's always critical to say, here's what we know. And importantly, here's what we don't know. And here's when we will get back to you again. So to be open and use risk communication strategy. Second, and importantly, and this is a problem everywhere, including in this country, even if you're very articulate, if what you're saying is not quite the same as the person down the road who's talking, who's different from somebody in the state across the river from you, we don't do well. And so we really need to work on coordinating our messages. You've seen one health department. You've seen one health department as that common phrase of the past. We need to get past that and say that, particularly from these issues, a communication standpoint, we do need to synergize and agree to give common messages in the same way. And third, and maybe most importantly, what is said is important, but who it is that is saying it is even more important in many settings. And so to be thinking about who it is that we're trying to reach and making sure that we're engaging the trusted messengers, the leaders for those individuals, particularly in communities that are marginalized, to make sure that we're engaging with leadership and engaging that leadership in conveying messages to families and individuals.
Another hard question, Eric. I don't think I'm going to answer your question, but I'll just make a few observations and then, we can keep chatting. So if we take weather back as the analogy, right? If the only thing we had weather stations for was to predict when a hurricane is about to show up, and we ignore all of the data in between, then what we will see is we put a lot of resources into detecting 5 events a year or so, right? If we're worried about hurricanes in the U.S. So that's a challenge at the level where the reporting is there's an emergency. The challenge is, how do you titrate funding in the right direction when the signal are these coarse signals that are separated by large chunks in time? So I think that's, again, from the sensor network point of view, that's what I'm kind of re-articulating as a challenge you just described. Now, as you layer in more continuous data, and again, using weather as that analogy, we know how to use weather data in between hurricanes, right? We use it to decide how we're going to route a truck, how an airplane will fly. Do we put a jacket on before we go to work? We use that data all the time. We understand it, even when it's not an emergency situation. And so I think that's a place that we need to get to, is a place where people are used to digesting this data, and they understand what it means with respect to the actions that they individually take and the impact it has on their communities. Now, the challenge with it, and this is where I said I don't have a good answer for the question, is when you go from weather data where we kind of know what it means to get rained on, or we know what it means to be, sitting outside and it's too chilly, when you go to data about the potential risk of getting an infectious disease, it's incredibly nuanced. Zika was a good example where, during the Zika outbreak, there was a question: do you fly to the Olympics in Brazil because it has the mosquitoes that could transmit Zika? That was the question, right? And the answer is, well, it's way more nuanced than that. It's where are they? What's the overall prevalence rate of the pathogen and that, in that location? And so communicating risk to somebody when it has that complex layer of biology that all sums up to tell you whether, what your kind of risk level is, I think is a challenge that I don't have an answer to it, but it's where that weather analogy breaks down a little bit. Then when you get to COVID, for instance, as it is now, where there was just a study out saying under laboratory conditions, COVID can survive for almost a month on surfaces, right? If you then suddenly had data about COVID on surfaces, how do you nuance that risk to a community so that they can take an appropriate and calibrated response, to that information? So I think at the high level, getting from this kind of data that only shows up during an emergency to continuous information about the state of the world is really important. The question that it opens up is, when you have that data, how do you communicate it and nuance it in a way that we get it like we get the weather? And that's, I think actually a pretty open problem. I don't know if you all have any other thoughts on that, because I don't have a good answer.
Well, yes, you sort of set us up for the first Q&A question from the audience, and this one is: what is the best way for citizen data scientists to get involved? What public data sources are available for citizens to analyze to improve health outcomes? Dr. Jackson, you want to lead us off on that one?
Sure. What is the right way to think about this? So I think, again, from the one, I'll think about this from the One Health lens, right? Where we're talking about what's going on in the environment. And through that lens, there's a number of data sets that go from the microscopic, what's the ecology of a virus, up to the macroscopic. What does habitat look like from a satellite? What are the hyperlocal weather conditions? So there are these strata of data that you need to make a predictive model. From the citizen science point of view, some of the easiest places to get into this area is to start with those kind of well-defined strata where the data sets are already open. So for instance, satellite data as it pertains to habitat, hyperlocal weather data. In the case of COVID, there are a lot of public data sets now that one can start to digest, can start to model, can start to think about. So from the citizen science point of view, I think a good kind of entry road are into those data sets that are pretty well defined and are actually kind of already pre-cooked and ready for you to get your hands on. I think the trickier one is when you want to take as input to a predictive system data where you don't have a full understanding of the chain of custody of that data. That's where it gets a little bit trickier. So for instance, going to the DNA sequencing technology, one of the things that's well known here is that if you take an environmental sample, you handle it, you get your DNA on it, you take it in a lab, you get lab, gunk on it. It all shows up in a sequencer. It comes out the other end and it says what it says, right? And then the question is, well, did that tell me information about the environment, or did it just tell me a chain of contamination that a sample went through before it got to the final data analytics? So I think from the citizen science point of view, there's a whole range of data sets. Some are actually very tricky to produce at the quality that you want, to make sure that you're not the signal to noise ratio is high. But I guess, okay, my advice to citizen science is, yeah, look at the epidemiological models, start with some of these data sets that are open and published, and and then watch out for things where chain of custody contamination is actually very tricky. I don't know if I answered the question or not. But.
No, thank you. And I'm curious if Dr. Mazad, if you've, here at Harris County Public Health, we've had a few citizen scientists in our community who've engaged with us on all sorts of things. I'm curious if you've seen any New York City citizen scientists engage with you guys.
Yeah, I mean, I think everybody is trying to find that treasure trove of data. I mean, that's the gold mine right there. And I think the gold mine a lot of times obviously is at the healthcare and the public health level. So I think one thing that has worked really well is there's so many people that want to help and contribute to the response, in the best way that they can. And so there's been a lot of, inquiry of access to data. And so I think that public health serving as a hub of having these data sets available at the local level for a lot of these scientists to go to download, and then to, whether it's for forecasting purposes or however they're using it for, that has been very valuable. So I think that, as we know, at the local level, folks are very much interested in getting this data, and so having it accessible and visible for the general public, and for those that are looking to develop platforms, forecast, and even the impact today, I think that's very valuable.
I would just add that maybe one of the most important things for citizen scientists is to help in identifying, and this may sound silly, but I think it's really important, what are the most important questions that need to be answered? It's one thing to start with data and try to dredge the data to say, what can the data be telling us? But sometimes what is more important is to go to the other end and say, what is it that we most need to know in order to respond effectively, and help develop those questions, and then figure out how to make data available to better answer it. As just one example, it's a small one, but I get frustrated with, we're a fair amount of ways into this, and the continuing response about immunity is, oh, we don't know. Well, there's actually some fairly direct ways that, in a rapid way, using information, for example, from contact tracing programs, and seeing whether people who have pre-existing antibody are less likely to become infected than those who do not, to begin to get critical answers to this question of, is there immunity, and to what extent does immunity confer protection from disease, and to what extent does immunity confer protection from transmitting the infection to others. Key questions that would substantially change our ability to effectively control this epidemic in ways that make public health sense, but we don't yet know. So it's the questions on the citizen scientist side of things that would be useful as well.
Thank you for that. Next question is from the audience is, they want to know, what do you envision as being the global health challenges in the next 5 years? COVID-19's in the rearview mirror, but what's coming down the road?
So let me quickly start on that. It's a great question. First off, hopefully COVID-19 is down the road, but I think that the effects of COVID-19 on the healthcare system, on the ability of healthcare systems to deliver care, potentially on the economies of countries that have pushed people into poverty will still be with us. And so there is a recovery from the epidemic that's not related to treating the disease itself that has to be top of mind. Already, like in the US, immunization rates around the world are falling. Already, malaria is resurging in countries where malaria is endemic. And so we will need to be tackling that, and hopefully tackling it in a way that transforms the way that we deliver services rather than going back to the old siloed way of doing it. In addition, let me just mention two other problems that would have been here independent of COVID, are still here and will still be here in the future. One is this amazing transition to chronic diseases around the world. Non-communicable diseases is the way that it's called in global health, but the epidemic of hypertension and diabetes and obesity and heart disease is now striking every country in the world. Countries that are poorly prepared to provide those long-term services is critical. And then the third is the intersection between planetary health, climate change, and health. We talk about it a lot in this country, but it's actually, in places like sub-Saharan Africa, where the environment is already marginalized, and where with climate change, many of the ways that people are currently producing food, for example, cattle farming, are no longer going to be viable. Those are the things that we need to be worrying about. Unfortunately, this is a profession where there's still lots of work to be done. And so our children will still have jobs in this. We're making progress, but as we make progress, new problems emerge.
So I think from my end, just to answer that, I think there's 3 points that I'd like to just quickly bring up. I think the first is, as Dr. Fleming already mentioned, we need to focus on, when we talk about the recovery of COVID-19, there's so much to unpack just in that. We know that just within these past 10 months, this pandemic has set us back at the global and probably decades worth of work in infectious disease and outbreak science, and how we've been responding to a number of different threats, not just from an infectious disease standpoint, but from many different aspects. So I think that there's a lot ahead of us that we need to continue to prepare for, and make sure that we have better infrastructure and processes in place. I think one stark example is the rise of MDROs. We're already starting to see that because of COVID-19. And so, immunizations along with that, and you want to make sure that you're looking at a lot of these vaccine preventable diseases and the altered schedule that I think a number of children are now on, but also looking at the rise of MDROs is going to be a significant issue that we need to keep a pulse on. I think the other thing to also make sure that we are continuing to look at and see how we can do better is the long COVID, so the long haulers. And we know that, when an individual can survive COVID-19, they're likely have significant, long-term complications. This can include, respiratory, cardiac, mental health disorders. It may even put them at increased risk for premature death. And so I think we need to make sure that we're preparing for that. We're responding appropriately. We have the right infrastructure and the processes moving forward at the global scale. The last thing that I'll mention, we've talked so much about, various measures and how we can do to better prevent and respond to future epidemics and pandemics. But I think one thing that is really, really important, besides the data and the surveillance and the monitoring and the intelligence that needs to go within this type of response, is the policy end. And we know that public policy has a significant impact on not just how we prepare, but how we respond and how we recover from these types of threats. Just here, for example, in the United States, there's a lot of public policies that have a very significant influence on the outcomes of these types of events. And to give you an example, if people are afraid to even seek healthcare services because of any anti-immigrant rhetoric, then they're not going to seek and go to a healthcare provider because of that. And we know that in the context of COVID-19, every individual has a means of igniting new chains of transmission if they, if they go out and they have COVID-19, for example. And so we want to really make sure that we are also focusing on the public policy end and seeing how we can change a lot of how we are regulating and governing the policy, even from a local and an international end, that's going to have a huge influence on how we better respond to future epidemics and pandemics.
Yeah, so I guess 5 years from now, 5 years from now, we won't know what the next thing is going to be, because if we look at if we look at that question, what is the next threat going to be? Putting chronic diseases aside for a moment, what is the next threat going to be? We're asking, what is going to be the next disease vector to emerge out of the biodiversity of the millions of arthropods known? What is the next, bacterial pathogen that will emerge, or viral pathogen, out of the 100 million to billion species that science hasn't yet identified? We don't know how many species exist there. So the attack surface, the potentials for things to jump out and surprise us is just enormous. And predicting what is going to be that thing, I don't think we can do it yet, right? So what will that thing be in 5 years? I don't know. But I think the macro trends, the three macro trends are pretty clear. One macro trend is that we will still add another billion or more people to the globe in the next several decades. And what that means is a larger increased risk for zoonotic emergence from the One Health point of view. Climate change, even at current climate pledges, is going to re-architect our ecosystems, over the next decades. We're seeing it already happen now. And that means everything from, changes in the distribution of vectors and pathogens to changes and even the emergence of novel agricultural pests. So even our food security is something that is going to intersect with the One Health realm. And then the third macro trend is both the loss of efficacy of our existing interventions, antimicrobials, and then perhaps the replacement of that with precision interventions that are, kind of re-engineering nature themselves. And from that context, I mean public health interventions that may replace an insecticide with a GM sterile insect, or, for instance, it's still kind of a ways off, but we're seeing phage therapies be used successfully in a few contexts now to treat bacterial infections that were not responding to any antibiotics. And that's where we're re-architecting our understanding of nature to achieve a more targeted effect. But it opens the question of, what does that all unleash, right? So those are the three macro trends that I see. I think standing here, I don't know which one is going to be the next epidemic or pandemic. But I think those three macro trends say we have to keep our eye on the ball and really think through in a very holistic way, as was just discussed, everything from policy to breaking down silos to the biology and the technology. Keep our eye on the ball, because something is going to show up again, and who knows what it's going to be.
Well, I appreciate each of you guys with your thoughtful answers, not only this most recent question, but all of them, and the thoughtful discussion. It looks like we're at the end of our session, and I really do appreciate this panel, and enjoyed moderating it, in part because it's a diverse set of experiences you guys have, diverse backgrounds, but still operating within that One Health Global Health lens, which I think is why One Health and Global Health are such powerful frameworks to work within. I would also, before I pass it on to Dr. Shah, who's going to close us out for the day, I just wanted to be remiss if I didn't thank my mom and dad, who drove from St. Louis, Missouri, so I could swing into the office for a day. So hi, Mom and Dad. They're watching my daughter, newborn. So Dr. Shah, I believe you're on and you're going to wrap us up. Is that right?
I am, Eric. Thank you, Eric, for hosting that, moderating that. You did a fantastic job. I think you made your parents from St. Louis proud. So fantastic job. I also want to thank all of our panelists on this last panel, certainly Dr. Jackson, Dr. Fleming, and Dr. Medad, for just what the three of their perspectives on this really important issue around both predictive analytics and really what's the future, how do we look at global and domestic health, and really the importance and the intersection of One Health as we continue to be thinking about the approaches to our current state of where we are with COVID-19 and well beyond. We've gotten some incredible feedback from all the people that have joined, and certainly on social media. So I really want to thank everybody for your participation. I also want to thank our first set of panelists earlier today that was moderated by Dr. Onyega, who did a fantastic job, as well as Dr. Galea, Dr. Benjamin, and Dr. Wen, the three of their perspectives on health equity and really the COVID-19 road ahead, as well as how we got here, were critical to the work that we're doing. So my job is to just close out with a few perspectives, and I hope you enjoyed the two panels as much as I did. Certainly it would be markedly better if we could do this in person, and certainly if we could have had 2 days in person to be able to really have the collegiality that was obviously not possible in the midst of COVID-19, but certainly I think we have really learned a lot. Now, looking ahead, I want to remind you of a few things. As soon as the webinar concludes today, you're going to be redirected by Zoom to a survey so you can give feedback on today's conference, what you like, what you didn't like. Please take a few moments of your time to fill it out and really help us as we continue to build this. This is, again, our 13th annual One Health Conference as we continue to build this for the future.